Today we will discuss about the bony orbit and its boundaries. First of all, we will see the location. Now, these are the two bony orbits, and they are located on each side of root of nose. This one is the root of nose, and on each side these are the bony orbits. Now, these bony orbits are the pyramidal bony cavities that provides rotatory movements for the eyeball, means like a socket, and also it protects the eyeball. Then after that, it has different features. First of all, apex. Now see that apex is directed posteromedially. Here is the apex on the optic canal posteromedially, and this optic canal lies just medial to supraorbital fissure. This one is the supraorbital fissure, and this one is the optic canal. Here is the location of apex. Then base. Now this one is the base, and it is seen as orbital opening on the face. Now this base has the supraorbital margin, infraorbital margin, medial margin, and lateral margin. Now supraorbital margin is formed by orbital plate of frontal bone. Infraorbital margin is formed by zygomatic process of maxilla and zygomatic bone. Medial margin is formed by frontal process of maxilla. Lateral margin is formed by frontal process of zygomatic and zygomatic process of frontal bone. Then it has four walls. Now this one is the roof, this one is the floor, this one is the lateral wall, and this one is the medial wall. Now one by one we will discuss about the walls. First of all, roof. Now this roof is formed by orbital plate of frontal bone. This one is the orbital plate of frontal bone, and posteriorly it is completed by lesser wing of sphenoid bone. This one is the lesser wing of sphenoid bone. Now this roof separates this orbit from anterior cranial fossa. Now this one is the anterior cranial fossa, and here is the orbital plate of frontal bone, and here is the lesser wing of sphenoid bone. Then other named features in the roof are anteromedially. Here is the location of trochlear fossa that provides attachment for the trochlea or pulley of the superior oblique muscle. Then anterolaterally, here is the location of lacrimal fossa that lodges the lacrimal gland. Now here is the supraorbital notch that is converted into supraorbital foramina, and through which supraorbital nerves and vessel passes. And posteromedially, you know that there is optic canal through which optic nerve and ophthalmic artery passes. Then after that, lateral wall. Now this one is the lateral wall. Formation is by the orbital surface of the frontal process of zygomatic bone and anterior surface of greater wing of sphenoid bone. This one is the greater wing of sphenoid bone. Now this greater wing of sphenoid bone separates the orbit from middle cranial fossa. Here you can see this one is the middle cranial fossa, and this one is the location of greater wing of sphenoid bone. Then this zygomatic bone separates the orbit laterally from temporal fossa. This one is the temporal fossa. Then named features in the lateral wall are the supraorbital fissure. This one is the supraorbital fissure that communicates the orbit with middle cranial fossa. See that here this supraorbital fissure opens into the middle cranial fossa. Now through the supraorbital fissure, there is passage of lacrimal nerve, frontal nerve, third, fourth, and sixth cranial nerves, nasociliary nerve, and superior ophthalmic vein. Then there is a zygomatic foramina on the zygomatic bone through which zygomatic nerve passes, and just below the frontozygomatic suture. This one is the frontozygomatic suture, and just below this there is a Whitnall's tubercle, and this Whitnall's tubercle provides attachment to the lateral check ligament of eyeball. Then floor. Now this one is the floor. First of all, formation. Now formation is by the orbital surface of maxilla, orbital surface of the zygomatic bone, and posteriorly it is completed by, here is the orbital process of palatine bone. Now this in this floor there is inferior orbital fissure. Now this one is the inferior orbital fissure that communicates the orbit laterally with the infratemporal fossa. This one is the infratemporal fossa, and with the pterygopalatine fossa. This one is the pterygopalatine fossa, this one is the infratemporal fossa. Now this through this inferior orbital fissure there is passage of maxillary nerve, zygomatic branch of maxillary nerve, inferior ophthalmic vein, and sympathetic nerve. Now see that in front of this infraorbital fissure there is a groove. This one is the infraorbital groove, and that leads into the infraorbital canal under the bone, and this canal opens on the face on the infraorbital foramina. This one is the infraorbital foramina, and through this groove and canal there is passage of infraorbital nerves and vessels, and these nerves and vessels emerge on the face through infraorbital foramina. Now on the on the floor anteromedially, here is the location of depression, and that provides attachment to the inferior oblique muscle. Then medial wall. Now this one is the medial wall. From anterior to posterior, it is formed by frontal process of maxilla, lacrimal bone, by orbital plate of ethmoid bone, and posteriorly by body of sphenoid bone. Then named features in this medial wall are the lacrimal groove. Here is the lacrimal groove that lodges the lacrimal sac, and this lacrimal sac through nasolacrimal duct opens into the nasal cavity in the inferior nasal meatus. Now this one is the inferior nasal meatus of the nose. Now this lacrimal groove anteriorly it is bounded by lacrimal crest of frontal process of maxilla, and posteriorly by the crest of lacrimal bone. Now on the medial wall, this orbital plate of ethmoid bone separates the orbit from the ethmoid air cells, and on upper part there are two foramina, anterior and the posterior ethmoidal foramina, through which the passage of anterior and the posterior ethmoidal nerves and vessels. So it was all about the orbit.